And Lauren, if you could switch to the next one for me. So a general introduction to the sort of concept of the measures in this toolkit. The sort of purpose of all of these webinars is to introduce a different way of measuring the impact and outcomes of interventions. So it won't be news to you, I'm sure, that this is something that should be fundamental to all of us who are delivering or planning interventions, that we make some measurement of the impact and the outcomes that they have. And doing that in a standardized way allows us to compare different interventions in order to understand things like cost effectiveness or interventions that are reaching different groups that might be important to achieving particular aims. So without clear evidence of the impact of an intervention, it's really hard to kind of justify the scaling up of it or the continuation of it. If we could go on to the next one. So the Birmingham Public Health Measurement Toolbox has been developed to try and assist with this by providing all in one place a suite of tools that can be used to measure the impacts of interventions targeted at improving health and well-being in Birmingham. So the idea is that it's there to support you with doing this and implementing this in your particular setting. And it allows us to make comparisons within a intervention in terms of how it's say reaching different aspects of a population, but also to compare between groups. And if we could move on to the next one, Lauren. The way that these talks are set out is kind of, we've tried to standardize it so that it's a bit easier to follow. And so these are the headings in terms of the different areas covered under the toolkit. Obviously, it's physical activity that we'll be talking about today. So if we could move on, we will be talking about the Short Active Lives toolkit today. And to start with, just a little bit of background in terms of physical activity in general. So we know that regular physical activity is very important. Hopefully I'm preaching to the converted on that. It can be a part of managing a number of different long-term health conditions and can be very helpful across the age range. So in children and young people, it's associated with better outcomes in terms of learning and attainment, as well as with mental and cardiovascular health and healthy weight. In adults, it's associated with protection against non-communicable diseases and mental health problems. And in older adults, probably the main take home is that it's incredibly important for maintaining good physical and mental health, but also for maintaining function and independence. And away from health, it's also just really important in general. So, social interaction, pleasure, enjoyment, engagement with our environment, engagement with our communities, and economic growth are all benefits associated with a physically active society. So if we could just skip forward again. So, accepting that physical activity is important, how much do we need to do to get these benefits? We have the Chief Medical Officer guidelines that help to give us some direction with this. But fundamentally, what's really important to take away from those guidelines, beyond the headline figures, is that any activity is better than none, and more is better still, obviously. It's never too late to start. So I was talking to a lady this morning who said, I'm 82 years old, this is for young people. And it's really not the case. There's benefits to be gained from starting at any age. It can be done it can be done every day, or it can be accumulated through the week. And that represents something of a change from previous iterations of the guideline that spoke about bouts of 10 minutes or more being required in order to derive benefit. And the evidence for that has been reviewed and the guidance revised, that this can be accumulated in any way that you choose. The thing that often gets missed out, or that people often don't appreciate about the guidelines, beyond a headline figure of this is how much exercise you should be doing, muscle strengthening activities should be involved twice per week. And in older adults in particular, activities that involve flexibility and balance are also really important to incorporate so that you get those benefits from the perspective of independence and functional capacity. So let's move forwards again. And one concept which is important when we're talking about physical activity generally is the idea that you know we have different forms of physical activity, we have different intensities of physical activity. People can do all sorts of different things to contribute to their overall level of activity, but we need some way of putting that into context and understanding, you know, where people are so that we can make comparisons. This graph is taken from the Sport England Active Lives survey data. And Active Lives is a survey which runs in adults and children every year, sampling random households in the case of adults and random schools in the case of children in England. And it produces a detailed picture of the physical activity habits of people across the country and releases a report annually. This panel shows the physical activity data for adults in the West Midlands from November 2015 through to the most recent data available, November 22. And in order to try and make it easier to work with this data, they have divided people into three categories. So the dark blue in the middle there is people who are inactive, so people who are doing less than 30 minutes of activity per week. The red is fairly active, so people who are undertaking between 30 and 150 minutes of physical activity per week. And the electric blue is then people who are active, who are meeting the Chief Medical Officer's guideline of 150 minutes spread through the week. And as you can see there, this is for the West Midlands as a region. A little over half of West Midlands adults are categorised as active, while 1/3 are categorised as inactive. And that's been fairly consistent through this study period. If we move forward to the next slide, though, we can have a look at the picture for Birmingham itself. It's broadly similar, although the drop in physical activity levels seen during COVID, so in that November 1920 period onwards, that drop is a bit more pronounced than it is in other parts of the country, and it's sorry, in other in the West Midlands as a whole, and it's led to a persistent increase in the number of people classed as inactive in the Birmingham area. If you go forward again to the graph after this, we can see that this helps to give us some context to those figures at a national level by comparing different regions. And so this demonstrates differences in the levels of activity by region. The West Midlands as a whole it is classed here rather than Birmingham Local Authority. And it shows that in the West Midlands, our percentage of people classed as inactive is our percentage of people classed as active is the lowest in England, and the percentage classed as inactive is the highest in England. If we go forward to the next one, then this is almost my last graph, I promise. What's particularly relevant to our population in Birmingham is that there's a major disparity between the levels of physical activity taken by people from different ethnic backgrounds. So this is a national summary which shows the percentage of populations from different ethnic groups who are categorised as inactive. So remember, that's less than 30 minutes activity per week. And it's noticeably higher in those from Asian, Black and Chinese communities than those from other backgrounds. And similar relationships exist in those with disabilities, in those with long-term health conditions, where the percentage of active and inactive people is nearly equal over the study period. So if we skip forward to my last graph, so to a certain extent, these figures sort of make for kind of gloomy reading, but they do represent an enormous opportunity. So this graphic is taken from the Chief Medical Officer's report on physical activity and captures the idea that the shape of the relationship between physical activity and health benefits is such that the greatest benefit occurs when people move from that inactive category to fairly active. So getting 30 minutes or more of physical activity per week. There are obviously more benefits, you know, for the more active that people are, but to achieve those benefits requires a much bigger increase in activity. So, for example, in this graphic, you can see that the first 50% of the health benefits you're going to get through physical activity requires reaching a threshold of about 90 minutes per week. But to get that next 50% requires an increase of more like 500 minutes per week. So, you know, there's a really good investment to be made in trying to move people from an inactive state to even fairly active. And so particularly thinking about our population in Birmingham, where we were thinking about different levels of participation from people in different ethnic groups, this is an area with a lot of potential to reduce health inequalities in our city. So hopefully then it's clear why physical activity is important, but particularly why we would want to measure how physically active people are. And importantly, how we might want to measure how that changes with interventions that we carry out. If we can do this consistently, then we can establish which physical activity programs are the most effective and which ones are the most effective in reaching different populations, which are the most effective in moving the dial from, you know, sedentary to fairly active, as opposed to just kind of maintaining high levels of activity in people who are already meeting those guidelines. So if we just move forwards again, so thinking about how we measure physical activity, Active Lives survey is the tool that Sport England use, and it includes aspects related to physical activity, sports participation, but also how many people are attending live sports events, how many people are members of sports clubs, what are attitudes to sport, etc. It's really, really comprehensive, and it covers not just physical activity sort of headline figures, but also behaviours and lifestyles and so on. And it's really great as a tool to go and look at different questions that you might have. So I'd encourage you to have a look at the Active Lives sort of search function on the Sport England website, which will let you build a query so you can add in the particular locations or populations that you're interested in and look at all sorts of different questions related to that. So it's, you know, believe me, I spent a lot of time fiddling with that resource in preparation for this, and it's fascinating. But the drawback of this really comprehensive tool is that it takes a long time and a lot of attention for people to complete. So it's not really fit for purpose as a snapshot of how active individuals are and how that might change over time, because if it takes an hour to complete, nobody wants to do that more than once. So the Short Active Lives tool was developed in a piece of work comparing a number of different short tools that you might be familiar with, like the iPack and the single item question tool, as well as looking at objective tools like accelerometers. So getting people to wear pedometers and seeing how active they are and how that changes over time. And in comparison with those other tools, the Short Active Lives survey was shown to perform really well in categorizing people into different, into those different buckets. So inactive, fairly active, and active. And it also takes only about a minute to complete. So it's kind of, sorry about that. So it's kind of meeting all of our criteria in that it's measuring what we want to measure accurately, but it's also easy to administer and easy for people to sit through. So if we go on to the next one then. The questionnaire itself consists of 3 sets of questions which follow a really similar pattern. So first, it's a yes/no question on whether the individual has done that activity in the last 7 days. And if they answer yes, there are follow-up questions to clarify on how many days they did the activity, how long they did it for, and whether it was of sufficient intensity to raise their breathing rate. So loosely classifying that as a moderate intensity physical activity. So you can see there the sort of question headings are, in the past 7 days, have you done a continuous walk lasting at least 10 minutes, a cycle ride, sport fitness activities such as gym or fitness classes or dance? And then, you know, if they answer yes, you complete the 3 follow-up questions for each of those 3 sections. So you can use that to produce a total number of minutes of moderate intensity exercise that an individual does in a week, and use that to then classify them as inactive, so 30 minutes or less, fairly active, 30 minutes to 150 minutes, or active, so 150 minutes or more, meeting the Chief Medical Officer's guidelines. I thought it was helpful just to go to the next slide, which it's going to be too small for you to read the questions individually, but I promise they're the ones that were on the previous slide. But this is the format that the paper version of the questionnaire comes in, so it fits one side of A4, and hopefully then is not too kind of off-putting for people. So if we zip forward onto the next one, in terms of the practicalities of using this tool, Sporting England have produced some resources to try and help. So they offer a paper version of the survey. On their website, they say they offer a web-based version also, but I've had some clarification from them this afternoon to say actually they don't offer a web-based version now, but it is fairly straightforward to set it up on something like SurveyMonkey, if that sort of helps. But they've also produced an Excel spreadsheet to assist with recording the data and with scoring the data. So I'll show you that in a second, and it's really helpful because it does the calculations for you and saves a lot of time. And I think that spreadsheet tool is actually really practical as something that you might sit down with someone and just fill it in as you go, so that you don't need to use kind of a paper or web-based version of the survey at all. They've also made an explanatory document on the Short Active Lives tool and how to use it, and that goes through some frequently asked questions and some of the sort of challenges and limitations of it. So really helpful if you do want to know a bit more, but you don't want to read the 60-page document that describes how they produced it. If we just move forwards onto the next one, this shows you a sort of breakdown of the scoring aid effectively. So if you imagine it's going across all in one row from the yellow to the blue to the green, and this covers the 3 questions and then the knock-on sort of questions that come from those that we had on the slide previously. So in the past 7 days, have you done a continuous walk lasting at least 10 minutes? Yes. Then you fill in the number of days, the minutes on each of those days that you did it, and was that sufficient to raise your breathing rate? It will then calculate for you the total minutes of moderate intensity activity the person did, and will give you a classification, so an activity level. Usefully, if you put in more than one person, it will also give you a summary of the different activity classifications that your group fits into. It's free to download, and you enter a row for each person that you collect the data from, and you can then use that to compare respondents within a group or respondents at multiple time points if you wanted to look at differences pre and post an intervention. The respondent ID, I've just got a note to mention that obviously we must ensure that we're taking appropriate proportions with our data, so not recording and storing identifiable details, but you could perhaps complete the initials of the individual, the age, and the date they completed the questionnaire with you, so that it allows you to recognise them. So if we move on to the next one now, let's try and make these things a bit more sort of concrete with an example of how you might use the tool. So this is John and Diane, and they've been running a walking football club for the last 9 months. So participants come and they pay for a 6-week block of sessions at a time, and they're able to run 2 sessions a week on a Tuesday and a Thursday night at a local leisure centre where they hire out a pitch. They want to try and get some more people involved, so they ask their local GP surgery if they can put some posters up in the waiting room. And the GP agrees, but he's a bit of a stickler for the details. So he asks, how effective is your program in helping to get people active? Because he's come across a few different programs in the past, but not had much kind of feedback on what happens to people after they go through them. And that's a tricky one for John and Diane to answer. They can think of lots of people that they've met over the last 9 months who've told them that they've really enjoyed being part of the walking football team, and they've come back for more, or they've said they intend to come back in the future, but they're not sure exactly how many people they've seen become more active in their program. So if we go forward onto the next one, Lauren, the next time they start a 6-week block, as well as taking down details like the name and the telephone number, emergency contacts and so on, John asks the attendees to complete the Short Active Lives tool until Diane points out that they could just put it straight into the Excel scoring tool as they see each person. And when they finish putting the data into their Excel sheet, and we've got like a little précis of that here, we've got 5 respondents that we filled in on the slide. They filled it in yesterday, and I've done that thing of giving them initials, age, and then the date that they completed it. So they can see that they've got, of their 5 new participants, 2 are classed as active, 2 as fairly active, and 1 as inactive. So with these respondent IDs and following the same process, however you choose to do that, you can then go back and identify them again in future. If we go on to the next slide here, at the end of that 6-week block, Diane and John repeat the process. And so by comparing the scores for their participants at the beginning and at the end, they can see what sort of difference completing their program made to the physical activity of their participants. So if you just look at the summary tables, that will kind of give you the information I'm talking about next. So 3 of their participants maintained their physical activity level. 1 went from being fairly active to active over the period, and most encouragingly, 1 went from being inactive to fairly active, which is a really good result. And informally, they also got excellent feedback demonstrating that all 5 have really enjoyed the program and would like to keep playing. We then go on to the next slide. Using that kind of information can be really powerful for demonstrating that an approach is effective. So if you have a sort of someone kind of wanting to know, well, how many people do you help and how active did you make them, you can refer back to that data. But also, you can think of a lot of other questions that you could answer with that kind of simple method as well. So how active are people at the beginning and the end of an intervention is an easy one. But if you're running at different venues, are you seeing differences in the people who are coming to those venues at the start? Are you seeing any differences in how effective the intervention is at those venues? So if you've got some people, for example, coming to the leisure centre, which is in the centre of Birmingham, some who are coming to a football pitch, which is a bit further out in more of a suburban area, then you might see differences in the type of people who attend those, how active they are and how well they do. You could look at things like different coaches and facilitators, different days that you run it, for example, a weekend or a weekday, different activities that you might include, and also look at different groups of people. So if you choose to collect information on, for example, ethnic backgrounds of people who attend the intervention, you can see if you're reaching a fair spread of the population of Birmingham, and also whether there are any trends emerging in some people becoming more active or not becoming more active. And that can feed into a feedback loop that helps you to identify areas where a service could be tweaked or improved in order to try and make sure that you're making best use of any interventions that you run, but also that you're meeting the brief in terms of the type of people that you want coming into your intervention and the type of results that you want to be getting. Thinking about a sort of higher level of looking at different interventions, this might also help you figure out, okay, well, what services are going to be most effective to try and achieve this thing that we want, and so which services should we kind of prioritize supporting. So if we move on to the next slide, just thinking about some of the limitations of this tool. So it doesn't account for vigorous intensity physical activity. So it calculates moderate intensity physical activity only. This graphic is from the Chief Medical Officer's report on physical activity and gives examples of different ways to quantify how intense an activity is, and examples of the type of activities that sort of fit in with that. So if an individual says they've done a bike ride on one day for 30 minutes, but that it hasn't raised their breathing rate, that would effectively equate to 30 minutes of light intensity physical activity. So you can use the tool to work out that, but there's no way of doing the same for vigorous or very vigorous activity. And this is a really interesting area which is kind of developing to understand, okay, well, there probably are some people who are able to do short bouts of very vigorous physical activity and get health benefits from that. So it's something which we might need to sort of pay more attention to in the future. It's also important to sort of think about an exchange rate between these different intensities. So the target in the Chief Medical Officer's guidelines is 150 minutes of moderate intensity activity per week, but actually light intensity activity counts for half of that effectively. So it's like 300 minutes of light intensity activity equals 150 minutes of moderate and 75 minutes of vigorous. So you might find that there are some people who actually are active, but it's not really being captured by this tool. As we said, it retains this 10-minute threshold for walking, which is different to the latest guidance from the Chief Medical Officer on how we can accumulate physical activity bouts. So that's a sort of limitation of it that we need to recognise. And it also doesn't account for strength and balance types of activity. So somebody may well meet the requirements in terms of overall numbers of minutes, but if they're not doing those other things also, it perhaps doesn't give you a full flavour of whether they're meeting the physical activity guidance. So if we move on to the next one. So just a couple of challenges that come straight from the frequently asked questions around the Short Active Lives tool. So individuals might say that the duration of their activity varies. So, I do ride my bike 3 times a week, but actually, I do a different amount each time. In that case, you can ask them just to work out an approximate average. This is just to give you a broad indication of where they are. And so once you break it down into those 3 categories of active, fairly active, active and inactive, you can see that, it really doesn't matter if you do 45 minutes on a Monday and 60 minutes on a Tuesday, you're going to be fitting into the same kind of category. Likewise, individuals might say that the intensity of their activity varies. So, for example, they go swimming 3 times a week. Sometimes they swim breaststroke at a pretty low intensity, but sometimes they swim front crawl at a moderate intensity. And in this case, you'd ask them just to estimate how they feel the majority of the time that they're doing it. A key kind of question in working out the intensity of the activity in the Short Active Lives tool is breathing. And some respondents might have this affected due to disability or other health conditions. So in this case, for example, thinking about maybe people with COPD or with asthma, you can ask them with reference to their usual level of breathlessness. So was the effort you put into walking usually enough to raise your breathing rate above any usual breathlessness that you experience? It becomes a bit more convoluted, but the idea is that you're getting some impression of what things are like relative to normal for them. Language barrier is important. So in a community as diverse as Birmingham, this may present a bit of a challenge and require some assistance in terms of interpretation. The tool hasn't been validated in different languages. So in terms of that kind of cultural competency, which we know is becoming really important, it might be harder for some people to articulate the intensity of their activity than others. There are challenges, obviously, for people who have cognitive issues. So if you're working specifically with that population, this might not be an appropriate tool to use. And it's not validated for use in under 16s. So if we move forward now, I've got a kind of summary slide here that just gives you a bit of a one-shot look at what this tool is. So it's available at the website there from Sport England. The target population is over 16s, and it is as broad as that, with the caveats that we've mentioned. At the beginning and the end of a physical activity program, course or intervention, that's the kind of time that you would get the most value from doing this. The ambition is to try and understand how physically active people are who might be using a service or going through an intervention, and identify how effective different methods of increasing physical activity are. And there is some benchmark data available to have a look at on the Sport England website via their full Active Lives sort of search tool. So I've got my penultimate slide next now, just to highlight that it is available in paper format, and a web-based format can be created. There is an Excel spreadsheet which is really useful for scoring the tool, but I would argue it's the most effective way of actually asking the questions and surveying people. It's just to kind of have that in front of you and go through that with people as you see them. And there is also an explanatory document that will give you more information on what the tool is and how to use it, available through Sport England as well. So if I leave those up just so that you've got a chance to take a picture of them, if you want to, but obviously this is recorded so you can see it again. Does anybody have any questions?